So why don't we do this thing? There's been a short introduction. Could you please put on the slides for Dr.Reena Sethi? This is the talk on why is there a need for a structured orientation on design and creating a modern ophthalmic clinics in today's healthcare scenario. What is the pressure on the practitioner to upgrade? Why are we upgrading? Why are we putting so much of money into all these things? Because this is actually whatever you invest in capital cost is going to play no role in your return in eye care. It's either for your own ego, or it's only for the fact that competition around you is forcing it to do it, or the new certification modes are coming, NABH, then JCI, or it is just that you need to do it. Because every time my father used to say that you can even do a practice under a tree, but gone are those days. Today you need to have a lot of equipment before they feel that they can impress on the patient. So that is why we have a structured flow. We'll start with that.
Okay. So very good afternoon and a welcome to all. So why really do we need a design module? We need a designing for your modern ophthalmic clinic needs what? It needs an architectural plan and a layout which will allow you to have a good quality eye care facility. You need that whenever your patient enters, he should know that it's a hygienically clean area and a functional area where the patients are comfortable while they're waiting for their turn to come. Or if they need to interact with the doctor, they have a better one-to-one kind of a private situation where they can discuss. And they need a lot of satisfaction in that area wherever they're coming for a service, so that they can go back and tell the others that they had a real good experience in the setup as well, not only with the doctor but with the setup as well. And you need it for the professional growth as well. Today we have technology which is at a level, maybe tomorrow it's something different. So, and plus the more you are in a very functional area, in a good area, you have a better way of explaining to your patient, and it's very satisfying to you as well. So basically, why do we need a design module? We need to plan a modern facility which is based on a design that is workable for quality eye care. So these are modules which are already there, which are workable, and these have already been proved that they have been very functionally good for people who have had these big hospitals. And also, if you need your present facilities getting very, you're getting difficult to manage, and you need to renovate your place, even then you need to see a model which is going to help you to make the right architectural decision in planning process. And if you're studying and if you're trying to make a better environment or an architectural design for your setup, then you already have what exactly you're going to explain to your architect, your needs, and this will give you a good clue about it. And a good design module does not take an additional space. We always feel if you're renovating, you need a bigger area and all that. It's really not. It's from that same area, a good architect who knows and understands the vision and has already done such work will try and give you your requirement of the space. So what are the features of a design module? These are flexibility and expandability, and it should promote efficiency. In flexibility and expandability, what do we mean is that medical treatment is always under a change. So it's not what it is today, it will not be what it is tomorrow. Hospitals should follow this modular concept of space planning and layout. So if, for example, whenever you go to an architect who's planning your facility for you or renovating it, his first question is going to be how many doctors are going to be working in that environment, and what do you think is going to be your capacity load where the patients are coming in. So if there says, if you say there are 4 doctors who are working in this facility, maybe you need 8 lanes, so that the doctor, because of the load, can go from one lane to the other and see the patients in a more efficient manner, and the patients also get worked up much faster. So it depends on your working pattern, your vision of what exactly you want. And use generic room sizing and plan. As we all know that our certain requirements are there, like an optometrist room has to have certain dimensions. We can't do less than that, and that all has to be kept in mind whenever you're planning to increase your or renovate your system or make a new one. Use modular, easily accessible, and modified mechanical and electrical. These are important things because everything needs upgradation and everything is changing. All your electricals, your mechanical systems, they are all changing, and you have to have an open-ended, well-planned direction for the future expansion. In promoting efficiency, a hospital layout should promote staff efficiency by minimizing distance between frequently used spaces. So if you have an area where dilatation drops, or for example, has to be put in, you don't want it in one end of the hallway. You want it as close as possible so that there is less movement of your staff as well as of the patients, and segregation of waiting areas should be there. So if you have a department which is like maybe a glaucoma or retina department, you have a specified area for those patients to wait, and you shouldn't intermix these patients. Allow visual supervision of your patients. Modern healthcare trends are rapidly progressing in technology and changing patients' expectations and treatment of modality. Patients are so well versed, they are on the net, and they are rather more educated than you in certain times. You know, they'll come up with all kinds of things, and you need more time with them. And the expectations are really high because some doctor somewhere has told them something, so they need better environment, better understanding. So you do need rooms which you can have counselors and explaining them, and that all has to be added into the space. So increasing presentations also for insurance, that has to be a separate, you have to think about it, and your accreditations are almost becoming mandatory. So there are certain norms for it, and you have to explain and put it into your designing. So, for example, you have these appointment and the EMR systems, which definitely have to be put into your work and also your hospital. And these have a lot of advantages, that they are more efficient in seeing the patients, and you have proper standard for the hospital administration and cost analysis. So you can know exactly how you can save your costing and how you can increase your efficiency. Architectural designs are methodology designs which allow physician to see the patient professionally while maximizing his staff efficiency. And a good design does not take additional space. And your planning should have, you know, you should, before your planning, in your planning, you must have a feasibility study done. What is the demand of that area whenever you're constructing? That's very important. Your land and your building should all have the due registrations and all the clearances, because that's number one point which is important. The land should be specifically allocated for the hospital use. And equipment, of course, requires investment, so you have to put it in the cost of your building up. And land and site clearances, like I said. So current scenario, you have a lot of clearances to be met with, and all that has to be put into the designing, the fire safety clearance, the insurance TPAs, what they want, the facility to be accessible to those with handicaps, so areas with wheelchair ramps and your specific toilet sizing and elevators. You need your OTs with HEPA filters for your NABH, and requirement for the OT size is also very specific. Number of recovery beds, ICU is becoming mandatory now. Also, there is probably a proposal to make it compulsory. Wherever you're operating, you have to have an ICU beds also, and medical gas outlets also are important. So certification accreditations, you need your state registration, NABH, and these certifications intended to improve quality of care. And one shouldn't sort of shirk it that I'm not going to get it done, because it's in the long run going to help your facility. And these insurance companies are also going to give you more leverage and maybe they will not be compiling with you if you don't have these accreditations also. They're becoming more and more mandatory. In building an infrastructure, you have to understand the functional flow, and that has to be explained to your architect, what is your vision and how it is being done otherwise, and allow for continuous development of technology and scope of the clinical services, various departments and their patient outflow. Green architecture and building is the new concept, and it is becoming more and more important, and for good reasons, because it's important initial and long term environmental quality and energy water conservation is there in this kind of a green architecture, and the effects of the design and material used on the sustainability of the world we live in. So we have to be more aware of it, that we need to have more designs, and your designs should have, I think, a little aesthetics, because that's what you're giving the patient. You don't want to give your patients a feeling of a 5-star, but you need to give them the feeling of an environment which is clean, hygienic, and made out of natural available products like your bricks and local stone available. Woodwork always gives a little peace and a calmful surrounding, and use a local artwork, water porta potties and all, they always go a long way to give a very good, peaceful environment for and positive environment. So in conclusion, designing an eye care practice is a process, and every one of us has their own idea and vision. We need a design that improves the efficiency of the surgeon and reduces the cost for the surgery patients. Thank you very much.